This is Dr. Chris Ferris, registered acupuncturist, and welcome to FIMIA, the official podcast for the Parisian Institute of Modern Integrated Acupuncture. If you are an acupuncture practitioner or student, or you have an interest in acupuncture, then make sure you go to fimia.com.au and sign up for free to get notifications on our latest courses and resources. On this episode of FIMIA, I am speaking with Doctors Chantelle Muellner and Angus Timms, registered acupuncturists from New Brighton, New South Wales, founders and directors of the Health Cove. Chantelle and Angus met in their first year of study at Endeavour College and have now been practicing for over 3 years since completing their degrees. Together, they have recently taken ownership of the Jade Tortoise Clinic of Natural Health. Yet inspired by the desire to offer a place of healing and rejuvenation, the location was renovated and the practice was reimagined into what is now known as the Health Cove. Located just north of Byron Bay, their practice offers the expertise of multiple allied health practitioners, providing a wealth of knowledge and support for their patients all under one roof. For Chantelle and Angus, this process has been a dream come true, as they have always been passionate about a move towards a more integrated approach to health. I met the pair about 8 years ago while studying at Endeavour College in Brisbane, and in just a few short years following graduation, they have gone from students with a passion for acupuncture to trailblazing business owners with eyes set for a world of new possibilities. Join me now as I get the full story on this acupuncture power couple, Doctors Chantelle Muellner and Angus Timms. Clear as day. All right, ready to rock this thing?
Let's do it.
I think
Okay.
so.
Let's do it.
Doctors Chantelle Muellner and Angus Timms, welcome along to FIMIA. How are you today?
Well, thank you. Thank you for having us.
That's good.
Very good. Thanks for having us, Chris.
Excellent. No worries. It's a pleasure to have you back. It's been a long time since we've caught up. How long's it been?
Oh,
I reckon it must be, three years or so. I think we last saw each other maybe in Byron. You guys came down.
Oh, yeah.
Yeah, Bruns
Yeah.
Pub. Yeah.
Bruns Pub, yes.
shared a nice meal there.
Yeah, very nice indeed.
Yeah.
It's like I had Olivia Jance on the last episode. It's kind of like reunion month for me.
Yeah, seeing
Very
everyone again. Yeah.
It's been nice catching up.
Yeah.
So, and in that area, you've recently got yourself a new business. Is that right? In the
Yes.
Byron Shire, is that where it is?
Byron Bay Shire,
Yeah.
yes. More specifically, New Brighton.
Mm-hmm.
So it's very cool for us. It's been a bit of a journey.
Yeah.
Yeah.
So what can you tell me about the process of that? Like, you had already been when you graduated, you had been working in a clinic under someone else. Is that right?
Yeah. So it's the same clinic. When we graduated, we were both lucky enough to be offered to work with Tim Lyon, who's an acupuncturist who owned the Jade Tortoise Clinic of Natural Health.
Mm-hmm.
So he was based in New Brighton, and we both worked there for a period of time, probably around 1 year to 18 months. And yeah, during that period, things evolved, and he ended up offering us an opportunity to buy the clinic off him.
Mm-hmm.
So we were pretty shocked at first,
Yeah.
and very excited. So, but we've been there for 18 months, and we knew how things worked. We'd built a fantastic rapport with our patients, and it was just a natural progression, really. So we ended up grabbing that opportunity and taking that.
Yeah, that must be quite an advantage to take over the clinic that you've already been working for a while, as opposed to establishing a new clinic in a different location.
Mm-hmm.
I think it was very, very lucky to have that opportunity and see it from that perspective as well. So we're both really happy with how things have moved, and it's been a bit of a blur the last 3 years.
Yeah.
Yeah, I bet.
Yeah.
So how long it's called the Health Cove?
Yeah,
right?
so we renovated and we rebranded because and Tim Lyon, it was primarily only traditional Chinese medicine, so it was only just acupuncture clinic, but it did grow over the years. So it's about over 10 years or so that he had it, and we had other allied health members join it. So we wanted a name that's kind of represented just a collective of our team, a multidisciplinary clinic, which would sort of evolve to.
Yeah.
Yes. So We changed the Health Cove, changed it to the Health Cove, which was quite a funny story. But when we were looking for names, like that was probably the hardest thing
Really?
to do. It was like naming a baby. Like we just
you do really want to get it right.
We wanted to get it right, but we really loved. We heard Cove a few times because we are in the Byron Shire and we're on the coast. And we just thought, when we looked at the definition of Cove, it really resonated to what our vision and what we wanted the place or our clinic to have and to go. So it realistically just meant that that a cove was just a natural formation, like a small inlet where sick animals, injured animals came. They came there to rest, to rehabilitate, to get better, or, mothers to birth their young, and then when they were strong enough, go back out to the wild. And we thought, this is it. This is what we want to create. We want to have a small clinic where, patients can come see us, get better, get well, babies to come along and move out there to the big wide world. Yeah,
and it's certainly, the name is certainly reflective of the region you're in, compared to if someone had a Health Cove in the middle of Brisbane City or something, you'd go, this a little...
Not so coastal.
Yeah, it's not, doesn't really fit the name, so I like that.
Yeah,
Good job.
Yeah. Cool. Thank you.
And so tell me about what you, Chantelle, you focus mainly more on women's health and fertility and hormonal treatments, is that right?
Yeah, and pregnancy, so I absolutely love women's health. I've always been really passionate about it ever since I was even a young age. I always wanted to work down that field. So I primarily see lots of women with anything from like teenage, like early period conditions or issues, then going through to like everything in between down to menopause. So I'm really lucky that I work with a lot of midwives in the Byron Bay Hospital as well.
Oh, really?
So they only take low risk births and you have to, which means that you have to give birth by a certain date. So the pressure is quite on for a lot of women in our area because they want to give birth in the Byron Birthing Centre, but they have to give birth in a certain amount of time. They can't go over. Which means they just get transferred to another hospital to start induction. So I guess I do a lot more inductions because the midwives are referring to do acupuncture for it and do everything that they can do. So yeah,
that's great. And I suppose when a lady is in that position, she's more likely to explore all these different options to get the best care and the most natural approach, if you will, or without having to take any type of pharmaceutical intervention to get to the most optimal results.
Yeah, exactly. Yeah, so it's been an absolute pleasure to work with women, especially. It's such a beautiful side of it. Yeah.
And are you gaining a profile down in that region as kind of the go-to lady for things like that?
Seems to be. Yeah, it seems to be. I think also, I think because I'm so passionate about it, I've always have been, it sort of just naturally have happened in that way. And I think, and also because we have both myself and Angus in the same practice, I think if, people are asking for that, we can sort of bounce back on each other. When I know there's like areas, for example, sporting injuries, things like that, which Angus is more passionate about, I can flick through to that way. Whereas, if we know people coming in for pregnancy, fertility or whatever it might be needing, it's nice to go, and Chantelle's interested in this. So it's a nice round approach to things. Yeah.
So tell me about that, Angus. You do most musculoskeletal and also athlete preparation and recovery as well.
Yeah, a whole range of things. That's pretty much the bulk of it, and then obviously pain management as well. But athlete preparation is something that I've found to really enjoy. Basically because we see a range of athletes from the area coming in seeking sort of that preventative care leading up to certain events. So recently I've just finished working with the Australian champion for the Ironman event.
Oh, really?
And he took out the gold, so that was for
because of you, obviously.
Like how else would he have got there? He basically committed to about 12 weeks of preparation sort of acupuncture work, and the goal there is just basically to keep him as loose and pain free as possible, so that he can, I guess, dominate his training regime.
Yes.
And yeah, it was just fantastic keeping him sort of on that track to his goal.
Yeah.
So then you see the end result of him actually taking that gold medal was pretty fantastic.
Yeah.
So that's a very rewarding type of person to treat. But then, yeah, we treat all sorts of amateur athletes as well. So your surfers, football players, all of that, which is very similar, keeping them moving, keeping them mobile, and then that education as well. So pre and post event or session out in the surf. That's sort of what I've been doing.
And in the area that's like in New Brighton and around that area, I imagine there are a lot of obviously surfers and more sports oriented people and yoga practitioners. And is that a large chunk of the people that come through the door, people that are actively involved in their own health and well-being through a physical medium?
Definitely. Surfing is a therapy in itself for a lot of the community. So you have the age ranges from, teenage through to 60, 65-year-olds. So, and all they want to do is be in the water surfing. So, I mean, making sure that their normal life is perfect in terms of aches and pains, but then being sure that they can actually go out and enjoy the surf for sometimes hours on end. It's their goal to be out there, basically. Yeah. When can I get back into the surf is a big question we get a lot.
Sure, yeah. And I guess that I was talking to someone the other day where they were treating someone who had been surfing for the first time in a while, and it affected their knees and their lower back, and it just made me think that the motion and the stance that you take surfing, that's a lot of
strenuous
work for your body, which you've got the QLs and your psoas and then all the quads and everything, and you're in that continuous squatting position, or the horse stance if you do martial arts for that whole period, and then you have to balance on water and evade sharks and everything else.
A lot of sharks. And then the paddle fitness as well.
Of course.
All of that. So definitely keeping the knees, the hips, that twisting and keeping the body under load for that period of time, mixed with the cold water as well. Can be quite a serious sort of movement.
Do you see any conditions that are specific to, if you're seeing more of the older generation that are doing surfing, are you seeing any conditions that are specific to that do they have more of a certain condition or even less of it because they've been more active?
The thing that we treat the most in regards to surfing is that the low back and hip. So that sort of a lot of that spasm type presentation, potentially leading into that false sciatica, the pain down the leg sort of thing. So that's probably the most common, and that's probably, as you said, the position that they're in. So lying down flat and then jumping up into that sort of stance.
I had someone come to me the other day and they had pain in the back, like just above the glutes. I'm like, it's sciatica, man. Someone told me it's sciatica, so it's what am I going to do? So you guys met at uni, right?
8 years ago.
8 years ago. So tell me about that.
It was crazy that we met in our first year out in Endeavour College, back when we were in Water Street.
Oh, right.
Yeah.
Did you do your first semester?
I think maybe first and second semester.
Start. I think it was halfway through the second semester that they shifted.
That transition happened. But there's almost so much to say. But it was just an absolute crazy surprise. And now even going out of university and working, it wasn't always in our plan for us to be working together. I always thought it'd be Brisbane based or Gold Coast based, and we did know that Angus wanted to work back in his hometown in New Brighton, but it was just pretty exciting, and it's been such a great adventure to now be in business together, and now our studies have led us to where we are now, so it's been really good.
But you're from down there, but are you from
Brisbane Bay?
Brisbane,
yeah. So I grew up in Brisbane. Yeah, which has been a nice. It's been really nice to transition down there. I love Brisbane and I always will, but it's been very special to now have the beach now.
Yeah,
100
it
meters.
must be difficult.
Oh, so difficult having beach walks on my lunch break now. But it has been a big change, but I haven't looked back yet. So
yeah.
So
can you guys give me a bit of the process of where you were before taking over the clinic, and then the actual development of it, just for people listening who, students or other people who are interested in taking on this challenge or journey of building their own business, and some of the challenges that you've experienced, or the highs and the lows?
I guess the work involved is quite high, but from my perspective, when you're an acupuncturist and you're treating people in your room one-on-one, that's already 100% effort in that room. So for me personally, taking on a clinic was having more control over that effort, I guess, and being able to, shape everything to do with the treatment from the moment that they ring the phone to the moment that they leave, the whole experience. So I guess I was already putting in that effort. So taking over a business was no different in my mind.
Yeah.
In saying that, it has made us, I guess, we sort of split our day in 3 segments. So we treat our patients, and then lunch break, sort of middle of the day, is more business related. So it's everything from admin through to all sorts of managing the other practitioners, even a bit of
social media, try and get all of that, catch up on all of that, and then
back into trading. So it's about, I guess, having a plan to prioritize the different parts of your day, really. And when we took over the business, it had been built 10 years ago, and it had sort of just been left like that. So we did a bit of renovating, all of the branding changing and all of that. So that was, we didn't have time off work, so it was after work through to late hours, all of that. So that took a toll, but it's all worth it, how it all shaped out. So I guess what I'm saying is, if you're in practice and you're seeing clients, that's already business. You're already in it. So just taking it to that next level, really.
Yeah. Why not just fill up all the rest of your time?
Why not?
With work as well.
You don't really need a personal life, do you?
No such thing.
No.
Plenty of time for that later on.
Yeah. But I don't know if you had anything to expand on that.
No, I guess, like it was nothing can really prepare you for it. So I think it's just get in there, don't be afraid to work hard, and just everything will, as long, I think. And also it's not about, I think a scary thing for us, it's like, yes, we are business owners, we are quite young, but also it's about having the team around you. So, that's, you don't have to be worrying about, all the financial stuff, because you have an accountant for that. Like, it's utilizing, your time and putting it for us, it's, doing our acupuncture, doing our work and doing what we do best. So I think just keeping in mind, for anyone that was to go into business, that yes, you are you having to control quite a lot, and you're having to think about heaps of different aspects of your clinic and everything around that. But it's also that you can have a team of people around you that can help you and will support you through that journey and through that transition. And I think we're so lucky to have had those people, because it would have been really difficult to do without.
Yeah, because you're running. How many other practitioners do you have?
I think we have 4 other practitioners. So we've got the psychologist, a chiropractor, and 2 massage therapists, and then myself and Chantelle.
Come a bit closer to the microphone.
Yeah.
And a naturopath that's starting on as well.
Okay. So how many is that altogether, including you?
So there's 6 now.
Yeah, 6 now.
Yeah, wow. Yeah, that's a big thing to run a team like that, and you're absolutely right to have that. So they also act as the kind of support network as well? Well,
yes and yes. So like they, at the end of the day, especially for our psychologist and our chiropractor and even our massage therapists, like they're doing their own work. So, I mean, it's not something that we have to sort of be, being, in charge of or minding or anything like that, because they are their own practitioner. And I guess, we don't have to... worry so much about what they're doing, if that makes sense. But I guess it's also, I mean, because we're a multidisciplinary clinic, we do have to have that lots of in-house referrals, which has been really quite lovely. And also have that support if we have a patient that is needing psychological help. We've got someone to go, we've got someone in-house to go, hey, you don't need to, it's not such a big step, I guess. They're familiar with the practice, they're familiar with the clinic, so they can go, I'm ready to take that step.
Don't have to travel far either.
That's good.
That's I think that's a big advantage of having all those different people that you can send your patients to, but also the fact that you make a really interesting point, which is that you don't have to, as a business owner, usually have employees that you may need to micromanage, or you're paying their salary or something like that, whereas you have, I guess, a clinic is a unique example of that, where everyone is running their own business and everyone is taking care of things themselves. So there's a lot of stress, I guess, that you don't have to worry about doing that.
Completely agree. Which is good.
Keeps the environment nice.
It does. It really does. And
I mean, we group every now and again and have team meetings and all of that, and that's where we discuss anything that we need to discuss. So otherwise everything runs very smoothly.
That's good. You had a really good point before, Angus, which was becoming in control of every step of the process. I've worked out of a clinic where it was someone else's business, and then I've also worked in my own clinic here, and the difference from, not that it was a bad experience at all, but just having that ease of control over things, where when the person, the first moment the person comes in contact with you on the website or Instagram or through a phone call, it's you from the start to the very finish.
It's huge. And
that's I imagine from a patient's perspective, that would mean a great deal to them.
Definitely.
So tell me about your experiences you've been having with GPs and Medicaid. You said that we were talking before, and you're saying that you're getting a lot more referrals these days.
So our GPs have been fantastic in the community. We've got a couple of them coming to see us as patients, and then we've got a handful that are referring as well. And in terms of Medicare, what we've been seeing is actually we've been getting EPC plans sent to us with our names, 5 treatments, all of that, but we can't use them. So I mean, the GPs are wanting to refer, wanting to put us on EPC plans, not realising that acupuncturists actually can't accept those because we're not on that Medicare platform.
But and on that note as well, is that they are otherwise they'll get an EPC plan that says acupuncture, but it will be potentially for a physiotherapist or someone that offers dry needling acupuncture, but they see our clinic and go, well, they've researched where can I get acupuncture in our area, then they bring the referrals through to us thinking that they can use it, and it is very difficult to explain, even though the form says acupuncture on it, an acupuncturist can't use it.
Wow.
So that's a big one.
So we see that a lot, and it's difficult because some GPs understand it and some GPs don't. So, sometimes they are doing the EPC plans to us and they didn't even know. So,
but I mean, that's a big positive and a big negative at the same time. Because like the hardest thing might be to actually get that trust and get that referral process happening, which it is happening. It's just not available for us to use. So I mean, the GP is finding that, hey, the best point of call for this patient is to get some acupuncture right now. I'm going to refer them to an acupuncturist or to someone that does what they think might be acupuncture. But at this stage, it's just not the case and it's not happening. So that's what needs to really change, I guess, is for that to be clearer.
It's I suppose there's definitely a level of frustration amidst our community as acupuncturists about that clear problem. But I mean, I guess things are happening as far as I know, and I guess we can look at it from the glass half empty or half full. At least we're this far ahead. And as you said, it's a positive that people are aware of it. GPs are obviously referring patients to you. there's just that small barrier in the way for the moment.
Yeah,
that's
exactly. Right. Yeah. It's frustrating, it really is, but the thing is it is great. It's happening, and patients are asking for it, and GPs are saying, yeah, no, I agree with you. I think that is a good option, but it's just not getting delivered to us. So I think it's the main thing. It's frustrating for us as acupuncturists. It's frustrating for the patient because they're kind of having to potentially go down the dry needling path thinking it is acupuncture. And then it's frustrating for the GP, so because they don't really know what's going on. So it's
So with your, how does that make you feel about the dry needling?
What's
availability?
I mean, it's more like it's a substandard treatment basically. So all of these practitioners that use it have a fantastic degree and they're fantastic at their jobs. But from my perspective, and maybe a lot of others, dry needling is out of their scope of practice. Or maybe not, but why not get acupuncture from somebody that is trained at a way higher level?
Of course.
So that's where I'm sort of sitting at.
Yeah.
I mean, in terms of, my patients might need an adjustment. I'm going to refer that to the chiropractor or the osteo. And then we've got our psychologist. I mean, we've done foundations of counselling, but that can take us so far. And then we've got a psychologist that's done an honours and a master's and all of this. So why don't we send them to the psychologist?
Yeah, it's like the foundations of counselling is like the equivalent of the 2-day dry needling course.
Yeah, probably even more advanced than that. Yeah,
yeah, we did a whole semester. Yeah. I agree. Yeah.
And do you feel like it's the actual application of dry needling itself, or the fact that other practitioners are doing a form of acupuncture that is the real problem?
Well, I mean, just from our short time in clinical practice, we just see things like, too much pain from that application. Patients are saying that, or they might come in and say, oh no, I don't want to get acupuncture today. Okay, so why don't you want to get acupuncture? Oh, my physio gave it to me and it was excruciating. And that's just something that doesn't happen in acupuncture.
Yeah, absolutely.
So, I mean, the application, the training. I mean, for me, I think, they can, I don't mind if they do some acupuncture or some dry needling, but why not go get a degree in it? Go do a master's. If I wanted to prescribe exercise as a therapy, specifically for patients, I would go do a master's in physiotherapy, because that's what's expected of APRA potentially.
We see too much, bad stories that come from it, and it turns off people or patients that are wanting to get acupuncture because they've had an experience. And it's always when you have to talk to them and have to explain, even though the physio said it was acupuncture, you do have to explain it and go, actually, really, it's not. So I think that's why it's frustrating for them. But also just, people, I've had a patient, actually this week when I got back into practice this week, they said to me, I'm going to China this weekend and I really want to get some acupuncture because of my neck. And I said, and I can't get into with my dry needling because they're away. And I thought, okay, cool, like this is interesting, it's really good they've come in. But they've said to me, I'm going to book it in earlier in the week rather than later in the week because my dry needle therapist won't treat me the day before I fly. And I was like, oh, okay, what's that for? And they said, because I might get a pneumothorax. So they do know the risks of it, the patient knows the risk of it, but having to explain that, it is safe to get acupuncture. And I see patients that get, especially living in the Byron Bay Shire, that fly in, fly out, in our area, that's not a problem for us to consider not doing a treatment because they might be getting on a flight that afternoon. Yeah,
so their thinking as a practitioner is every time they do dry needling, they potentially might be doing a pneumothorax.
Yeah.
So that's not a good way to think.
But also, and also that patient was okay with going, oh no, but I might get a pneumothorax, and knew the risk and was still, that's just not something that you should be considering, I think. Yeah.
They probably don't know the full risk of what that is.
Pneumothorax probably sounds like some sort of, I don't know. something that's not as sinister than it really is.
A new way to realign your back. I've seen that on a form, a consent form. I won't say where, but I saw that on a form for dry needling somewhere, and it had said that as well, that by signing this you consent to the risk of a pneumothorax. And I was very surprised that's actually, I know there are a lot of risks with any medicine. That's what happens when you go to hospital. Anything can happen, and the benefits outweigh the risk. So I understand that, but I suppose coming from our perspective, where that's just, you never do that. No. You train 4 years, so that never happens. Yeah. Although, in saying that, there are stories of certain practitioners that happening as well, and not because of a lack of anatomical knowledge, but there's certain things. I think I heard a story where a practitioner was inserting the needle as the patient was inhaling. Yeah, took a deep breath in, and it caused the needle to go into the thorax, and that's an acupuncturist. But in saying that, the risk of having it with an acupuncturist is obviously
far much
closer to zero.
Yes.
We don't put it in our form and saying that this might happen.
Yeah.
So just be aware, you can't go on a plane or get into scuba diving or anything like that. That's
I can't imagine that.
On that note and I had a really interesting one as well, where it's very conflicting to know what really happened, but especially seeing lots of women and pregnant women had someone in their second pregnancy, and they were talking to me how they had sacroiliac joint pain, SIJ pain, and they wanted to get acupuncture because it really helped relieved it. So I was like, okay, cool, like that's good, great, your body responded well. But they said something to me that the osteopath or whoever the professional that was administering dry needling was pinning into a sacroiliac area of her back, which was really interesting. But she also was saying that her first pregnancy, because I always do a screen about how their first pregnancy went and everything like that, she said that that day and that weekend, it was a Saturday, I remember her saying, is that she ended up going into labour, being induced then, and having a baby at a preemie at under 32 weeks, which we know as an acupuncturist you will never ever be pinning into the sacral area, as we know what it can be potentially be doing. So it was really interesting I remember it was really early in my practice, being super shocked, but
so that happened as a result of this?
Yeah, which I can't say, where it happened, but did happen. And I was just thinking in my head, even to this day, like, how is this happening in the Australian health industry? Like, it's not just about pneumothoraxes, and it's not just about, all of that. It's just about, hey, there's so much to it. There's so much damage we can potentially do. And was that baby born because of, potentially doing acupuncture to cause an induction? I don't know. Yes, no. Does that osteopath or physio, whoever did the dry needling, do they think so? No, they don't. But it's because they don't have the training and the knowledge.
They're not aware.
Not aware of what actually pinning into that area, stimulating all those nerves, stimulating, oxytocin, all of that is, for us, would be an absolute legal havoc on our end. So, I think, it shouldn't be happening in Australia. But the thing is like what Angus was saying, if you want to be prescribing exercise, for us, we would be doing our masters in exercise physiology, physiotherapy, which is something that we have considered. But it's because you want to be delivering the best that we can for your patient. And I think that's why we're so passionate about it. It comes back down to, interdisciplinary care. It's sending your patients to the best practitioner that you think are going to get the best results. It's working together, working collectively, not just in a clinic practice, but, on a outside of that. Yeah.
Do you have someone to treat digestive health, or do you take care of that with acupuncture, or?
We do a little bit of digestive health, but having a naturopath on board now,
of course,
that's gonna they're really big on digestive health. So but we do a lot of digestive work with as we know, Chinese dietetics, all that warming type foods, often that's the direction we go with that. Which seems to help a lot of people. But it's going to be great to be able to bounce those sort of ideas off our naturopath.
So have you got plans for expansion? Do you have room for expansion down there?
We do have room. At the moment we're quite happy with how things are going, but definitely we're always thinking about these things. We find that just as enjoyable as trading. So we're definitely always have things in the works, don't we?
Talking to different people at where we can go with it.
Start opening up new locations.
Come back to Brizzy.
Health Cove 2.0.
We have to be near the water though.
Yes. Only near the water.
Definitely.
So with your approach to treatments, you tend to also look at it from a Western medical perspective as well to help to explain that to your patients?
That's one thing that we are quite passionate about, and that's sort of where I guess we look at the modern approach of acupuncture as well. So we find it really important to actually communicate more so in Western medical terms than traditional Chinese medicine terms. And that's just how we've sort of developed that in the clinic there, and it's worked really well for us. So I mean, when we get say like a tradie coming in with acute back pain, maybe he's picked up his toolbox, put it in the back of the ute, felt a twinge, back's gone into spasm, and it's the first time he's come to see us. Definitely approaching that with terms that he can grasp, and he's sort of grown up, I guess, hearing, rather than jump straight into this is a chi and blood stagnation, or these are the channels affected, bladder, gallbladder, whatever it may be. Just so that he's walking out knowing that this is what happened in that session, he gets it, rather than walking out, that feels pretty good, but I'm really confused as what's happened in there. What is chi? What is this stagnation? Is my bladder okay? So that's sort of where we approach it from.
And with your musculoskeletal treatments, do you aim for trigger points and referral patterns? Do you do very anatomical based treatments, or do you do more? Very much so, So our treatments could be described as quite messy, which we're very hands-on.
We're super manual.
So I mean, a typical treatment specifically for musculoskeletal, which would be about 80% of our practice, would be massage, which would be more like a Chinese remedial with oil, so based off that Twainer, but more with oil. We don't use so much a towel, so more oil, hands-on, and then we do a lot of cupping and a lot of acupuncture. So it's always, majority of the time, a combination treatment. And then with a lot of heat as well, to relax and vasodilate those sort of muscles, blood vessels. That's our standard treatment, and that was sort of based off working with Tim, the previous business owner. He was all about that, and he really helped shape that sort of treatment for us, which we're really blessed to sort of have.
It's been something that we really, it's been really effective, and it's just, like we were saying, really messy. It's super physical, but it's, we really push to try and, like, our treatment plan's always around quite small, so we always try and get results within the 3 treatments. So we always tell our patients when they're coming in,
thanks to a certain lecturer that we can't remember.
We were on the way trying to think, who was it that said to us, you need results within 3 treatments. So we put so much pressure on ourselves.
We accidentally stuck to that ideology
that we really I mean, case by case, obviously it can be different if you're working with potentially internal stuff, fertility of course, but from basic musculoskeletal,
so it's always, that's the expectation, isn't it? 3 sort of,
you want at least something happening.
We need some form of positive result within 3 sessions.
And I think that's why we go in like full guns blazing, just with a lot. And I think when you're, they're seeing the value of the treatment, and also there's so much, but that's going on, like why we're doing that. It's like massaging, obviously it feels good, relaxes a patient, especially if they don't, like, they're a bit unfamiliar with pins, but also like our hands, like I've just realized in the last few years, really trying from this different approach, our hands tell us everything. So I think that's why you're picking up a few different things that potentially when, you're palpating with a towel or doing things like that, you might be missing. Yeah.
Yep.
Definitely.
So, which is why we quite enjoy
all that
it.
information that the body has to
and
tell
you're going,
us.
This muscle's twinging because of this reason, or all of that. So we like the MSC approach. It's been good.
With you say you're going all guns blazing in the first treatment sometimes.
Mm-hmm.
How do you manage your patient expectations as far as what they are supposed to feel the next day? If, sometimes tweenar can be quite intense, and they can call the next day if they're not told, saying, why have you broken me?
Yeah.
And why do I feel worse now?
So I guess that's definitely case by case, and that's the beauty about our profession, is that every treatment is slightly individualized. So that's through proper communication with the patient, keeping the pressure tolerable so that you're not making them jump out in pain and tense other parts of the body. And also, before they get onto the table, this is what I'm going to do. How does that sound? And then if, that's a verbal consent, they're happy. And then also, you could feel a little bit flared up for a day or so. Is that going to be okay? Yeah, I expect to be feeling like that. I want to get better.
Yeah.
In saying that, often they're not flaring up either. So.
And also, if you are wanting to flaring up, it's kind of like talking about why we want inflammation.
Yeah.
We're so trained to go, no inflammation in that Western society, but our Western medicine, but more about we actually kind of want to vasodilate the muscles. We want all those histamine responses to come in, flood the area. We want it to be flared up because it's going to get you better quicker. So,
start that healing process again.
So that they're not, I'm so sore and everything. It's, what did Angus do? What did Chantelle do? It's kind of like, this is good.
Yeah.
And also a few tips on how to reduce that treatment pain potentially. So keeping hydrated, keeping the muscles warm, filling them with blood after treatment. That can help reduce that treatment pain. If there is going to be any. That's sort of our approach to that.
Yeah, it's an interesting concept when you have, treating something like tennis elbow, for example, which is chronic inflammation, and then you're explaining to your patient, well, we want to get acute inflammation to get that to heal, which will then ultimately start to reduce the chronic inflammation. And I think that's because for early on, that was something that was actually baffling me. Because, as you know, my understanding of TCM with the explanations of hot and cold and everything like that, I needed a more concise and comprehensive understanding of what's actually going on a biological level. And then I came across this concept that there's different forms of inflammation, and there's good inflammation and there's adverse inflammation. And you want to have the good inflammation for a brief sporadic amount of time to boost the immune system and the healing process, and to ultimately eradicate the chronic inflammation.
Which is not good for our bodies.
So with your approach now, moving on into the future, how do you see the modern application of acupuncture, like in regards to how it was in the past? Do you see that the continuation of an ancient form of medicine now that, you speak mostly to your patients on a Western medicine approach and anatomical and physiological approach? How do you see the development of TCM?
I think for me and for Chantelle as well, I think we just want to continue utilising our degree basically. So we've been trained in a Western and Eastern perspective. So really carrying that forward into the future, the way it's travelling, and hopefully just continuing basically being on par with other allied health professionals. So if you have a patient come in, they've got a team around them already, potentially. So they've got their GP, they've got their physio, they've got their personal trainer, and whoever else may be there. We want to be able to communicate with those other professionals on the same level, so that when you've treated them, they can go back and maybe tell their GP or tell their personal trainer or their physio, this is what my acupuncturist has been doing. Okay, that makes sense. But if they go back into their circle and they say, maybe, they did this, they said something about qi, maybe they might not understand that. We studied for 4 or 5 years, and we're still going to learn about this traditional Chinese medicine, but you've got an hour with that patient. So, I mean, as time develops and that rapport develops and they start asking questions, that's when we delve a little bit deeper. But to start with, we really want them to walk out understanding what you've done. And we're lucky that Endeavour provided that sort of dual almost degree. So we have the knowledge there, and that's where I guess I'd like to see modern acupuncture continue forward maybe.
Yeah.
And that's very specific to us as well, like our clinic and how we're working there. So it's not for everyone, but that's how, personally, I sort of approach it and how I see it. Staying in this modern environment of health, and also moving forward onto Medicare and onto EPC plans, really being clear and not being so, how does acupuncture work? And talking in that traditional Chinese medicine sense. We've got the ability to translate that for people now. Luckily,
Would you, Chantelle?
Oh, yeah, no, that's exactly how I was thinking as well. I think it's just really important to, guiding in that modern day approach that we are using that language through, because we are communicating with the midwife. Well, for me, working with the midwives and with those patients, and, you are just, really got to let them know that we are here to help and we can use our evidence that we've got. We're so lucky we've got so much evidence now around us, talking about that evidence to the patient, if they're going through IVF or not, and they're doing the most, and we're having experience for myself working in a clinic where it was predominantly IVF, but the fertility doctors were referring their patients to get acupuncture whilst they're doing their IVF treatment. It's just such an interesting contrast of in a modern day approach that we are doing the most clinical Western treatment, so medicalized, but they're still doing this beautiful Eastern treatment as well. And I think so in a modern day world, it's talking about, instead of saying lots of that chi and blood, you're kind of just more talking about especially in the reproductive organs, talking about your hormones, talking about your cortisol levels, our stress hormones, stuff that they go, oh yeah, my stress is, even though I, in my brain, I'm still thinking about liver chi stagnation. I am thinking about all of that. It's just that I'm really keeping it quite modern so they can go, seeing my IVF doctor, and then I'm also seeing Chantelle, my acupuncturist, and she's also working on stress levels or whatever else it may be. So I think that's where I would love to see acupuncture keep going in that approach.
And then even out all these hospital trials that are coming out with a really high success for the emergency wards and things like that. I mean, we're stepping into a Western framework in that sense, so we have to be able to keep up with that. Who's gonna be the one administering acupuncture in those hospitals? Is it going to be the physio, or is it going to be an acupuncturist? So we have to be able to be amongst those sort of allied health practitioners, and I guess hold our own and be able to communicate with them in a successful way.
Yeah.
Do you think it's a hindrance to acupuncture in any way to be taught in a very Eastern paradigm with concepts like qi and a different version of blood, to then be translated ambiguously into all different ways, because qi is now, it's hormones, it's neurotransmitters, it's your energy levels, and blood is pretty much everything else. Do you think that is to our detriment when we're trying to become more accepted by a Western paradigm, that we if they were to, for example, if a physio or a GP sees the notes that we write,
it's going to be scribble.
It's going to be this whole new language. I don't think so. I think because we have this crazy wealth of knowledge, so I think it's in a way, no, I don't think it's to our disadvantage. I think it's pretty crazy that our brains can work in two different ways. Like we're constantly thinking in two different ways. So I don't think it is. I think the only reason I think that it can be potentially detrimental is just when you are talking to the medical, professionals around you, your GPs, your allied health, if you are wanting those, patients to come through, is, making sure that you're using that language, that it's coming from a TCM root, but you're delivering it in a Western way. So for example, talking about heat and, even talking to the GPs, that it's not all about ice anymore. And we've got the research now to show us that I'm really grateful that we have that Eastern
history
knowledge,
there.
that we can say, no, actually ice isn't what we thought it was. So I don't think so. Is
there anything you would like to see changed in the way that acupuncture is delivered in universities and colleges?
Week 1 was tough. 7 subjects doing the Bachelor of Health Science alongside the Eastern medicine. So that's the only hindrance from that conversation that I can see in terms of grasping both at the same time. That can be quite challenging. But in saying that, every class was like an enjoyment to go to, and you're getting a taste of this, a taste of that, keeping things fresh. So
kind of was like a puzzle in a way. When you were starting, it was like you didn't get it, you're like, oh, how am I going to get this puzzle to work? But you do each subject, and one you start making it all, and then all of a sudden you get an aha moment. I think it was probably towards maybe in my last week and I was like, okay, it finally makes sense. So
you start seeing some better results come in.
But I coming from I had a very conservative upbringing. I never had acupuncture, I never had natural therapy growing up, really. I found it very challenging to just go, what is this, and make sense of it. It sounded very hocus pocus, but like I said, I stuck with it, and it all at the end of the day, it all made sense. Like,
it slowly married up.
It does marry up at the end.
What brought you to acupuncture?
For me, it was I had a sporting injury. I was swimming at a state level, and I just kept dislocating my shoulder, and I at the time was seeing every allied health under the sun. So I was seeing teams of physiotherapies, specifically on sporting, and then also seeing orthopedic surgeons, to a point where we couldn't work out what was going on. And I was in so much pain, I remember at the time, and I couldn't move my shoulder. It was like kind of locked up. And my dad at the time sort of said, oh, let's just go see this acupuncturist. Actually, his name was Chris Miller in Brisbane. And I just remember refusing in the car. Like, I was like, you're crazy, Dad. Like, what are you doing? I don't want needles. Like, I just thought, no, this is not going to work. You're wasting my time and your time. But I just, had the treatment, could move my shoulder, was not in pain.
After that first session?
My first pain. I did it quite a few, maybe about 6 or so. And I remember going after school being excited for a treatment, going, this is making me feel better. And I think because I was such a skeptic and it had never been part of my life, that really was quite special. But then he said to me, what do you want to do when you finish high school? And I was saying, my acupuncturist was saying that, and I was saying, like, I want to be in women's health. Like I said, I wanted to study midwifery. My mum's a midwife. I really want to do something with women. And he goes, go see Peter Kington. He's my best mate. He runs a fertility pregnancy acupuncture clinic in Brizzy as well. And I was like, okay, this is weird. I didn't know acupuncture can even help my shoulder, but I didn't know it could help women specifically. And I did a few weeks with Peter Kington, and it was the best thing I've ever done, because it just was like, yes, this is for me. This is private practice. I'm working with women, and it, not only did it help my shoulder, it can help with what I'm really passionate about. So I was really lucky to have, my shoulder to give out, because it is where it got me here today.
How about you, Angus?
Very similar to Chantelle. Mine was, again, a sporting injury, playing for Queensland in basketball.
No.
You wouldn't pick it.
6'8", not a basketballer.
People ask me that a lot in clinic as well, and same response. So only really one serious injury, and that was my ankle. So just coming down from a play and landing on my foot, twisting that, black and blue sort of up my leg.
Yeah.
And being 17, I think, wanting to be part of that tournament. Not accepting the physios, saying 4 months of rehabilitation and all of this. It was just too much for me.
Yeah.
And then one of my teammates recommended an acupuncturist, and that was my. I'd had a few sessions for other things, but nothing so specific and so important to me. And so basically, long story short, getting treatments sort of weekly, ended up being 100% better in 2 months. And it was a very serious ankle sprain. Yeah. So that really led me to want to know, hold up, why isn't this our first point of call? If that's 50% better than what I could get anywhere else. Yeah. So that's what sort of led me on the path of wanting to know more. Went to an open day at Endeavour and signed up. Yeah, wow. Awesome. Yeah.
For upcoming students, do you have any advice now that you are trailblazers on the path to multi-clinic business owners and at least multi-modality at the moment?
I think my advice is definitely do work experience outside of your uni. Get into clinics. I think that's what I did, and it just from a student, you're seeing so much more. Like we're really lucky that Endeavour had an amazing student clinic, but I think stepping into private practices is just incredible. Even if they are multidisciplinary or just acupuncture, I think you are going to get a wealth of knowledge of just even how people are running their businesses. I think is just this information that is just incredible. And patient management is just always something that I'm forever learning. So I think do as much as you can. If you are a student and you don't mind giving up one of your Saturdays or one of your days in the week, or even just half a day, and if someone is willing to take you on, take it, because it's going to pay off.
That'd be a good thing to see the college do as well, even like a placement type situation. Part of the degree would be really cool. I mean, a lot of other allied health professionals have placement, so that'd be interesting. Yeah, but that's a big point. Yeah, getting into clinic as early as possible.
As early as possible.
Yeah, finding a maybe not a permanent mentor, but at least someone to have. A brief exposure to, someone to look up to.
Even multiple clinics, seeing how multiple clinics work. Do a month here, a month there. Type thing.
Yeah, that was certainly. You guys had the experience before graduating anyway, right?
We were doing it for a couple of years. During the degree.
Yeah,
I certainly felt at the end of the degree that I just jumped out into the unknown, and I had really no idea what I was doing. It's very fortunate to have Nikki McDonald take me on as a mentor at her clinic in the beginning stages to help me with that, but definitely valuable to have that exposure before you get out. So at least when you graduate and you go into clinic for the first time, it's not a completely foreign experience.
Yeah, not as daunting. Yeah. I agree.
Yeah.
I guess the only other thing is like what we were saying earlier is touching bodies. Like I guess we don't really do that so much in our degree looking back. Like I thought I was touching bodies heaps, but you're sort of palpating here, using lots of towel work. But I think really getting in there, getting your hands dirty, touching bodies is really something that I've learnt now going, I wish I learnt more about that through my degree.
Yeah, so you think more of a, like, just encouraged to be more hands-on with the approach?
Yeah, don't be afraid. I think I was a bit afraid to touch the body, actually. Like I was, you swipe, you're going in there, you have a little palpate going, QL muscle or, piriformis glute, whatever it may be. But that was it. But, getting in there a little bit more with your hands, I think there's other things that may be underneath or, feeling fascia, feeling, tendons, all of that. I feel for me it has given me so much more information about what's going on in my patient's body at that time. I
think it also the separation between the tweener and the acupuncture clinic, I think it would be great to combine them so that you have an ability to combine the two if needed.
Yeah, if
Yeah, because
needed.
that's what it's really.
That's what you're going to be
we
doing.
do.
That's what you're going to be doing
Yeah,
in clinic.
Yeah.
You're not going to be doing them so separate.
Yeah, I think it's that it's less common for someone to graduate and then just solely focus on tweener, unless they've done the diploma, obviously.
Yeah.
Yeah,
But yeah, you're right. It's more of the mixed treatment.
yeah.
And
And then you enjoy it more. The patient gets a more rounded experience, and you learn to use your tools appropriately rather than saying, okay, this is just an acupuncture session, this is just a tweener session. Hopefully I can use some cups today if they're available. You can actually combine as needed, specific to that patient who's in front of you.
Yeah. Do you have anything else that you want to add before we
wrap it up?
Wrap this one up.
No, I think that's everything that we would love to discuss. That was
thanks so much
really
for having
good.
us.
Yeah, thank you so much.
Thank you for coming all this way. Where can people find you on social media, websites, everything like that?
Yeah, you can find us at thehealthcove.com. That's our handle for pretty much everything. So Instagram, Facebook is The Health Cove, and then our Health Cove is our website.
Yep. And do you have, with the space you have at your clinic, do you have places where other acupuncturists can come and hire spaces or like rent rooms or anything like that, or will there be something like that in the future?
At the moment we're fully booked with our practitioners.
Yeah, with our rooms.
But things always evolve and change. So we always encourage people, if they're wanting to move down that path, then come in and see us.
Yeah. And what about with your passion for students having exposure before they get out, is your clinic a place where students could potentially come and do that?
Definitely, yeah.
Definitely, of course. Yeah, it's something that we would love. Yeah.
Yeah,
we've had been approached a few times, but just been, something that there's been interest for. So definitely, but a bit more like naturopaths and a few others. But now that we've got like naturopathy in as well, we've got it's not just with acupuncture, with other allied health that they were wanting to as well. So yeah, definitely
plenty of space for that.
Yeah.
Awesome. All right, well, Dr. Chantelle Muellner and Dr. Angus Timms, thank you so much for coming on to FIMIA today, and we will no doubt have you again on in the future.
Thank you.
Thanks, Dr. Chris.
Looking forward to it.
Thanks guys.